First of all, hi, I'm Rich Brennan. I'm the Vice President of Federal Affairs with the ALS Association, and been engaged with CPATH since the onset of the funding that the Act for ALS initiated for CPATH R&D. And so we readily integrate activities with the federal government, FDA, NIH, and because of the importance of the public-private partnerships, as part of that work, we're very interested in engaging in the exchange of health information and advancing research through the collection and also the analysis of that data as well. As I stated, the ALS Association has relationships across the continuum of care, as well as, so we're interested in both research that can also directly influence care services and clinical services. And so any way that we can do to make sure that ALS is a livable disease is where we place our efforts. So the private partnerships and CPATH's work, especially in the rare disease community, in their neurology space, has really been important for us to necessarily determine what sets of data are important in the United States, how we can start to integrate that data, as well as then combine it with other pieces of data so that we can have one repository where we can utilize that for research and to accelerate the research for ALS. So, I mean, being here on the ground, getting the opportunity to, first of all, I was able to speak today, so that was important to our work. Because the ALS Association, our primary mission is to make ALS a livable disease. We do that primarily also by understanding what is the patient's experience, what is the experience of the family, how does the ALS affect that entire dynamic, and then how can we utilize what we learn from those experiences that we learn from our patient advocates and be able to drive innovation that way. So people like Lane Olaf, who I would like to mention, that really has utilized every conceivable avenue to make an influence, and I mean, I'm talking about, you know, he serves in committees, on federal committees. He's engaged in influencing what clinical trials look like. There are many ALS advocates that's what they utilize. Their mission is to impress upon the necessity of making a difference in this disease state, and also utilizing the rest of their lives to make a difference for the lives of others. So that's the most important part about our work, is that we get a chance to work with them and to lift them up as well. So it's a great coordinated effort. One of the reasons I'm here today is because the National Academies of Science has spent about 2 years determining the answers to these types of questions on what type of data sharing would be necessary. So both the federal government and the public partnerships are very engaged with determining what data can be utilized to make a difference in advanced research in ALS. Part of the recent report that the National Academies of Sciences says that we should work on is an interoperable national data registry for ALS. So it's a high and lofty and hard thing to do, but in working with the various institutions, universities, ALS clinics across the United States, others who serve people living with ALS, as well as pharmaceutical partners and also the federal government, combining those forces, we can really make a difference. And so CPATH is just one of those places that we can come together, have those experiences to meet with others that have like-minded, initiatives, and learn from each other as well.